You're listening to Bark and Wag's 15-Minute Vet Talk. Each week, your host, Polly Requa, interviews veterinarians and individuals in the pet industry from across the nation answering pet questions. Bark and Wag podcast is produced weekly for your enjoyment, and show notes can be found at barkandwag.com under the podcast tab. That's BARKNWAG.com. Please remember to subscribe to Bark and Wag 15-Minute Vet Talk.
Thank you for listening to Bark and Wag 15-Minute Vet Talk. Bark and Wag is dedicated to protecting our dogs through advocacy, education, and supporting like-minded dog lovers by selling custom pet products. Bark and Wag is excited to announce our new partnership with a Colorado hemp farm to produce a line of CBD products for your pets. Bark and Wag has CBD pet tincture available in 300, 750, 1200, and 2400 milligrams. Bark and Wag CBD is pet safe, no THC, it's made in the USA, and is CO2 extracted. Please check out Bark and Wag's website, barkandwag.com. That is BARK, to see our line of CBD and awesome merchandise. We love pooch ideas for podcasts and merchandise, so anytime send an email to Polly at barkandwag.com with your suggestions.
Welcome to Bark and Wag 15-Minute Vet Talk. I'm your host, Polly Requa. Today we're talking to Dr. Laura Brown, owner of Green Tree Animal Hospital in Libertyville, Illinois. Welcome, Dr. Brown.
Hi, Polly.
Thank you for coming back on the podcast. I have a question for you. So our black lab, who is a counter surfer, we had gotten from the vet 30 Rimadyl because with the coronavirus, we're going on lots of walks, and she has some back leg arthritis. And seriously, in a span of about 10 minutes of the girls running errands and myself, Maddie jumped on the counter and ate all 30 Rimadyl.
Well, she would not be the first dog that's happened to.
Yes. So I wanted to find out what happens when a dog, because I know we had to have her stomach pumped. We had to have an IV all day on the next day on Saturday and Sunday. But I just was wondering behind the scenes with their body, what happens when they do eat too much of a Rimadyl or any other medication?
So Rimadyl is a non-steroidal anti-inflammatory. So same family as Advil is for people. In dogs, this kind of leads into another discussion we've had before about why dogs should not take people medication either. Because it's super unsafe for dogs to take people Advil. And so same reason is too much non-steroidal anti-inflammatories in dogs. First level of problem would be a GI problem. So gastrointestinal ulcerations could be mild to very severe. And then the second part is liver failure.
Okay.
And it does affect their kidneys as well. But their liver really does not like that, cannot metabolize those drugs well enough before the liver cells themselves it's too toxic on the liver cells and they just die off.
And what's the time frame? So what happened was she ate it. Amanda, who's my daughter, called and said the pill bottle is all over the floor and all the pills are gone. So I called the vet and she said, well, you have to pump, the dog's stomach. So on my way back home from my errands, I stopped at Target to buy some peroxide.
Hydrogen peroxide, yeah.
Yep. And the vet called back and said, with that amount, we need you to go to the emergency vet, which was not them.
Got it.
And so then I took her over to a different vet. So what is the time frame before you would see an issue?
Pretty quick. So if within an hour of ingestion, they should be made to vomit. That's what you're thinking about the hydrogen peroxide. Mm-hmm. But much longer than, even it gets absorbed pretty fast, especially if it's the chewable kind, and they chew them. That's why they get into them, because they're tasty. So, and it also depends on the body weight of the dog, how many milligrams they got, and all of that stuff. So it's, there's not like one perfect answer for that. But if someone were not recognized, if Amanda wasn't on the ball and didn't realize that what had happened, or you guys had been gone for like 2 or 3 hours and got back that much longer, that might have been potentially irreversible damage.
Okay.
So getting it out of her system right away with vomiting. And the best way to do that is at your vet with a drug that we give IV that works within like 30 seconds. But at the same time, with you guys in Colorado, if you're far from an animal hospital, I think we might have talked about this, like if you're on a hike or something, hydrogen peroxide will irritate the stomach lining enough to make dogs vomit, but it's not foolproof. It doesn't work every time. And sometimes people overdo it and damage the stomach. So if as a last resort, you're out, 2 hours from the vet, you could at least give it a try.
Okay.
And there's a place to Google you can Google how much hydrogen peroxide based on my dog's body weight.
Okay.
To make them vomit. The other key to hydrogen peroxide, the reason it works is it's really bubbly. So the bubbliness is what irritates the stomach lining and makes things come up. So if your hydrogen peroxide is 5 years old, it might not work either.
Right. Okay. Right. Yeah.
And it also works better if there's a little something in their tummy to eat. There's a little bit of substance in their tummy to get stuff to come out. So usually when we give the drug called apomorphine that makes the dogs vomit, I usually throw them a few treats or something and make sure they got some bulk in there, because that helps get stuff out better too.
Okay. So one funny part of the whole scenario was that the doctor gave us an IV pack to do by ourselves on Sunday.
Under the skin or in her vein?
In her skin.
Yeah.
So like in the nape of the neck.
Yep. So that's called subcutaneously. Okay.
So when Amanda, it was already disgusting, but like to put the needle in her, but we were both down on the ground, and so she was so excited she roll over on her tummy.
Yeah.
IV would come out and there'd be saline solution all over. So we were not successful.
No, you couldn't get it done. The whole point of that is to try it. The more fluids, like they kept her on IV fluids, right? To help.
Yeah. Yeah.
So that helps the liver metabolize, not have to work so hard to metabolize those toxins and speeds the process up. And, so that was the whole idea with that and doing it under the skin at home. We can do that on a different podcast about sub-Q fluids at home and why they're important. We do have more cat people than dog people do that on a regular basis when their dogs are in kidney failure. It helps prevent keeps their kidneys from going into failure and I've had people do it for years.
Yeah. Well, when Chuck the Pug was sick, senior, we did that, except there was an actual like port. So it was already, it was already hooked up, but this one was like kind of winging it.
Yeah. You had to stick the needle in.
Yeah.
Big cat like Maddie's a little trickier than a kitty that, smaller target. Yeah.
Well, thank you for all the tips and letting us know what happens when your dog eats 30 Rimadyl pills. And we certainly look forward to having you back on the podcast.
Thanks, Polly. Good to talk to you.
Thank you for listening to Bark and Wag's 15-Minute Vet Talk. If you like what you just heard, we hope you'll pass along our web address, www.barkandwag.com, to your friends and other pet owners. Have a pressing question for a veterinarian? Ask your question at barkandwag.com under the podcast tab. This has been a KFR production. Join us next time for another edition of Bark and Wag's 15-Minute Vet Talk.